Dr. Ajit, you spelled Arabian Wazarat al-Sahha very well. I like the pronounce. As well, I like your face. Is a polite doctor. I got treated in my life as a local and showing myself as a labor, entering place and place. I was well treated by a doctor who is more polite, and the worst part, psychologist, was when the doctor is proud. His nose is high and his degrees are too much. So that's another sickness for me. I had a small comment about what he said. Let me put it in Arabic in such a way that I like this Arabic. We say in Arabic, al-halaqa al-mafquda. That means a missing point. As an introductory of my own part, I do represent Dubai Government Health Department in the area of Nadd al-Shiba. I live there, so I represent the locals. Once every 3 months, we have a gathering in the clinic of Nadd al-Shiba, which is next to the palace. And Dr. Afaf al-Hashimi, she is the granddaughter of Prime Minister. She's the director. We discuss a few things. I would like to add something in the HR within the area of Halaqa al-Mafquda. Anybody can translate what is Halaqa al-Mafquda? I said already in English. I said missing point, okay? We have a missing point in between private and public health sector, the database. I was born in Kuwait Hospital. We do not have any Dubai Health Department. When I was born, we had no regulation of the oil and energy and Federation of it was only Dubai. So I have my basic database established, which goes into the Ministry of Health, not in the Dubai Health Department. While all my children were grown and born in Dubai Health Department. Fortunately, I am a good producer. I have 10 children. Okay, 9 were from Latifa Hospital. Only 1 was Dubai Hospital. Now we have database which is in Dubai Hospital. I have database in Dubai Health Department. I have the same in Federal Ministry, which is Kuwait Hospital. Now if I enter in your hospital, like you are a German hospital, Subhi Batarji, the owner is my friend. I can call him now, okay? Engineer Subhi Batarji Abdul Jalil. If I come to you, I'll come with 0 database. You don't know about me anything, which is a mistake. There should be a unified database of clients, how I born in Dubai Hospital, how my children were born, and what is my sickness record in private, public, under one screen. Since Dr. Rai said it's alive, I would say a few words in Arabic to the administration part of UAE Federal Ministries and Health Department. تحياتي أحبتي والسادة المشرفين على القطاع الطبي. أتمنى يكون عندنا قاعدة بيانات موحدة. الجانب الصحي, as much we are unifying database of the economic and structure of insurance and money and monetary and IMF, World Bank, it's more important to have a database which is health database. How Ahmed Ibrahim was born, where, what is history till now. If I come to Germany, they should know it. If I go to Dubai Hospital, they should know it. So I would appreciate that this proposal should be considered from all sides. Thank you for everyone.
Excellent. Thank you very much. And to be honest, I do have to agree with you. I feel like there is a gap between the public healthcare and the private healthcare. And I feel like if such database, like you mentioned, did exist, I feel like more patients like yourself, locals of the United Arab Emirates, would be more open to visiting the private sector because you know that they know your status, they know your condition, they know kind of effectively what you're going there for. But if you were just to turn up, like you said, you're a brand new patient, they don't know your history, you have to explain everything from A to Z. So thank you very much for the insight. Excellent.
Yeah. First of all, I thank Mr. Sodrai and that as an engineer and the film industry well-known person, moving on to the medical industry and then bringing all of us in this sector. And I've been noticing the last 4 years, in India also I've been fortunate to see the events, and then it is really a great job and what he's doing to the medical fraternity. Okay, in terms of data here now, since I'm here last 30 years. I've been a practitioner and then moved on employer in the medical service side and then moved on to the medical insurance administrator. So definitely this country is one of the best country for many of the people. That's why we all here, and then the freedom of speech, and then entering to the happening things. That's the most important here. So if I looked into the senior level here, who started driving in a medical facility to be available is the biggest challenge in 50 years before. Like as he said, our local gentleman here very clearly marked on it. But then if you ask me, when I enter here 80s, late 80s and 90s and all, wherever I join in hand with the Ministry of Health as well as the Dubai Health Authority, the concern was that to create a good medical facility. And then we talk about the quality of the manpower and to retain them, the challenge in economically, all that, it is a big challenge. But if you compare now, last 10 years, I can say, there are a lot of medical facilities here, and a lot of recruitment processes there. And then, pull and push is always there. It's not that, we can one find more. But again, if you see that lately, the retaining of those professionals, it's more matured because of the entire system has come up now. Another thing is that if you just talk about the data, that is what we are all working here to make sure it is everyone gets everything. So that the insurance compulsory started from 2006 onwards Abu Dhabi and then 2013 in Dubai. The basic idea is that not only provide the medical services here in UAE, it's also connected with all the medical providers and in terms of pharmacy, the hospital, super specialty, everything. And it comes to under the one box. This box is the last 3 years we have been conducting, we know that where it stands. We know this population, what kind of disease they are having. So if you say that the analytical process, it's now well established these days. Now, as you see that until 2 years before, you have to go and wait for all that we are talking about. As Mr. Chogadra, you said it is 30 minutes waiting here, this and that, and approval and the TPA approval, all that. But as the process, it's growing, and you see that it has progressed in largely. And the outcome of it, what is it now? From last year onwards, that our ID card is implemented, and there is no printing. Most of the insurance companies, most of the TPAs, they are not printing the medical insurance card because it is associated with the insurance associated with the general immigration and residency. So what happened it is this uniqueness, and then thereby the data is started. Now if you ask me, in Dubai government, we have last 4 years, we know how many patients are here, what kind of patients are here, what is required further to move on. So it's all like, then if you ask me that, as a one single entry, that any hospital we go, we will know that, what's happening there. And then what is the very narrow gap it is? Transferring without the person acceptance is the legal questions. It stands. Where we are all working on, and I think the government is taking a great level of, matured recently, and then that's going to be published. So that, the patient information is will be spread over here, so that a doctor of A treating, the patient, B can also see all the reports. So it's improving, and as you see that, this is one of the best country. Many things are, set it up by standards and the international standards. That I think this is a very positive, and I'm really thankful that you have come up this level. And then Sondra, 4 years before when we had a first session, I was a part of it, and you are making every day, and then you're making some kind of jealous. I think I really thank you for all this kind of work. Yeah, this is what it is. Yeah, thank you very much.
Excellent, lovely. Thank you so much. And totally agree. I feel like although the healthcare system does lack a few things at the moment here, we are moving rapidly fast. I mean, just in January when I was at Arab Health, I saw some great improvements that were being made by the DHA. So very excited to see what the future holds.
Yeah, just to add one more. All of you now have had experience with general practitioners, family medicine, specialist consultants everywhere. But if you compare big countries, this is a very nice country, very hospitable country. They are providing huge money and infrastructure for the treatment. But then, if you see pediatric subspecialties are lacking. What is there? I quoted my example as a consultant neurologist. Leave alone the CEO job. I practice 10 hours a day. My wife is a consultant in pediatric nephrology. Where will she apply? Because the choices are very less. Now I am a consultant neurologist. I am a professor of neurology treating childhood and pediatric neurology diseases also. But many of the insurances does not permit me to treat mental retardation, inborn errors of metabolism, autism, hyperactive pediatric children, and various other conditions like dyslexia, autism spectral disorders. So this also, which is very common. And in the Emirate of Abu Dhabi, the DOH or erstwhile HAD classifies pediatrics up to the age of 18. I know people who have shadow teachers kept in the home, children who have so many small disabilities, they come to me but they don't open the file. I feel this forum should make a representation with the help and permission of all of you, put together that these underprivileged children of God, men, the female child or the male child, should also have access to quality medical care. Lastly, a common disease called Down syndrome. That is a mental retardation. If the Down syndrome has got epilepsy, I cannot even treat the epilepsy. Otherwise, I have to write wrong in the case sheet. That means a case of epilepsy. But I cannot say that the intelligence is normal. So without compromising on any of the ethical measures, we have to have a forum where we are able to treat underprivileged and mentally challenged children, as well as bring up pediatric subspecialties everywhere. Pediatric cardiology is available everywhere, but pediatric nephrology, pediatric gastroenterology, pediatric pulmonology, pediatric psychiatry, everything also has to come up in a very large way across the Emirates.
Excuse me, I just want to tell you an example because we haven't analyzed any examples which shows the real loss for an organization, because it's information from my friend. They brought a surgeon for a limited contract, that means 6 months contract, to get the MOH license, everything, another 3 months that they spent. Altogether 9 months money, it's almost 80,000 into 9 you can work out. Then after coming here, because he got the license, everything, but after coming here, they realized that this person hasn't done a surgery for so many years. So they had to send them back. So his villa renovation, everything altogether, the company lost almost 700,000 dirhams or something they lost. So this is an example. Another thing is the doctor was brought in. He is a left-hander. The operation theater is all set for the right-hander. So the doctor has to do a surgery like something like that. So this is another case. So many HR heads are not aware about this kind of issues. So you have to be very, very careful. You need to filter all these things before the real loss causes. Thank you.
Absolutely. Attention to detail is key.
It's been I'm just trying to summarize the whole thing. It's been a brilliant thought process across the panel. Thank you so much. Dr. Raza Siddiqui, Dr. Nakpal, Dr. Thambi, Sohan Bhai, and I think we've done a great job. I think just answering your questions to the EMR, the electronic medical systems. I was just sitting with Dr. Yunus last week, who is the right hand to His Highness Dr. Khatami. I'm just introducing a very revolutionary, innovative product in UAE, which requires the statistics and the infectious diseases, which is like 70 diseases in UAE. We have been approved. We are in the final stage. 28th is our final cabinet meeting. I think probably I'll give the good news. And also the HAD has approved us. So we are talking about 300 to 400 million saving for the government. I think we are in that stage. I think I just wanted to give you the good news, being the president of WMC, if I can contribute something and tell you guys the government is accepted what I have proposed. Now, I think more important is what is the prevailing diseases, what is the demographic incidences, So we have been able to give them all the statistics. So Alhamdulillah, I think we all here trying to do something for the second home, which is UAE for us. I think India has always been very close to our heart, though we are unfortunately too far from India. I think it's been a wonderful evening. I think the awardees are waiting very impatiently for the awards, and I think we should go forward on that. Thank you so much.
Thank you.
I do agree with the ethics of HR, and especially we are playing with the humans, like their life, their job, and something. But sometimes we stuck with. I have an experience I want to share, so it will be clear from the experience. Last month, one of the candidate, he resigned and he went to another competitor. So the reason why the patient, because it's a long-term care and rehabilitation center, it was a specially trained therapist. So the patient recommended, no, I will be staying in your hospital if you provide me this candidate who is working in that hospital. Because I have an experience, when I went that hospital, I saw him very well and treat me well. So I want that candidate or that staff to be here. Then it came to the case manager, and case manager discussed and gone to the CEO, and CEO, they recommend yes. To the HR, please hire them, whatever we want, whatever we pay, please hire them. So in this case, I want to share the HR side, HR personals, they do respect the ethics and we respect the human's job and everything. But at the same time, the industry, if they go for the money-oriented or they doesn't respect humans' job and something, the higher level management, like CEOs, they also need to be ethical in this field. Am I right? So if this happens to the CEO levels, they should say, sorry, we will do our service and we will treat them what we have. And if we will look for the best candidates, but sometimes it happens because if the patient left to the hospital, they lose per day, maybe millions they lose. So in this case, I want to recommend, because we have a lot of CEOs here, please, the same ethical side, we want to share to the all CEOs, those in the health industries. Thank you.
Supporting you very clearly, while I was with the Wazart-e-Saha, the Mustashar Wazart-e-Saha, I also had the opportunity of being the cabinet of Sheikh Hamad bin Zayed, who was the chairman of an authority which we created called ADGAS, Abu Dhabi General Authority for Health Services, which later on bifurcated into SEHA and HAD. Now in that memorandum of creation of that authority, we categorically emphasize the need for HR. So we also propose that each person will have an EHR and also central data repository and interoperable between private and public sector, but the right of access to that record will be with the patient, because the record of that will belong to the patient, and wherever, if he goes from public sector to private sector, he'll have to give a consent to the doctor to access. Second, anybody who has not written that can only see, not edit. But what you have done, you have written, you could edit. So therefore, these rules were already framed before ADGAS was created, and it grew into something else later as HAD and SEHA. Now, I also remember the person who was head of, when HAD was created, somebody was exclusively appointed to implement the program of HR, information system for the patients. I do not remember his name yet, but I think a very big initiative. No, somebody from outside. He came from, I think, Munich Re or somewhere. I won't remember. Let me not take more time. But I'm saying that besides one more issue of having the disability amongst children, I was also responsible for creating a law that there would be marriage, there would be genetic testing before marriage. But it was not made law that you could not marry if there was a conflict. I'm told the last 4 years, this issue has been debated. The law of having genetic testing before marriage was made during my time, but I think there is now a ban on marriages if there's a very serious conflict, last 4 to 5 years. So I'm saying that a country like this is thinking wisely. The top management, the leadership of this country is willing to accept, provided there's a consensus amongst the profession and we take a proposal to the government for acceptance. I think we should all, this WMC can really create that unification of ideas to take this to the government to make them into law. This is what I think this is what I
No, already WMC, we created medical horoscope. That concept already we launched actually. So that is not made a law or something. We already developed that concept, medical horoscope.
Hi, Dr. Vinod. Doctor, you had mentioned about having pediatric nephrology and pediatric subspecialties into hospitals. Yeah. So on a HR point of view, you know, the rate of cases for pediatric cases are not much in the country. Like, you know, we are having a pediatric surgeon in a hospital and the rate ratio was 1:1,000. And on a hiring point of view and an HR point of view, how exactly would we be able to cope up with these?
Number one, it depends on the institution where you serve. Is it a standalone single medical center or a hospital or a group of hospitals? If so, we talk about the billions, millions and all for the government exchequers and the business industrialists. But for the individual hospital, we are talking about something like paying 50,000 to 1 lakh dirhams per month for a particular doctor. If we are able to add the value, suppose you put a physician for 50,000 dirhams and you want to take 5 times of it, you want to take a revenue of 2.5 lakhs. That factor of 5 or 10 times, you may have to reduce it for some facility. I hope you got it. Suppose it is a pediatric surgeon that you said, or a pediatric nephrologist or a neurologist, pediatric gastro, pediatric pulmo, leave alone oncology, which is premature now. If you are putting a salary, don't expect the same factor fold of getting the revenue back. At least if the doctor is taking 1 lakh, let us get 1.5 or 2 lakh. Then you can network with CME programs and the basic drive of that doctor will bring in patients from competitive hospitals.
Thank you, Doctor.
Excellent. I think we're finished. Thank you, everybody, for your inputs. Thank you.